I have the pleasure in introducing our first panel of the day. We have Silas Webb, who is an ST4 in emergency medicine, who is based in the northwest of London at the moment. We have Alex Taylor, who is also coming down, who is a registrar in emergency medicine and pre-hospital emergency medicine, currently based in Severn. And we have Rosa Gallup, who will also be joining us. There she is. Who is a senior sister currently based in Leeds. So our panelists will be sharing their personal stories of how they got into research for the first half, and then we will have some time at the end if you guys have some questions as well. So I'll hand over to Silas first.
Hello everyone. I'm going to have my slides up here just because it's got my timer on and we've got 6 minutes, which is not very long, and I'm at high risk of waffling. So thank you for inviting me, Anissa and the GECCo team. My name's Silas and I'm an emergency medicine registrar currently working in London. And as a full-time clinician rather than an academic, it feels ever so slightly fraudulent to be sharing the programme with professors, those with PhDs as postnominals, and other well-renowned names in the global health sphere. But here I am. And speaking to Anissa and the conference team, what they wanted during this session was just to try and show the experience of some of us who are in the early steps in the global health research sphere, and I'm going to briefly share my journey so far. So this was me 10 years ago during a student-selected component at university when I was lucky enough to undertake a project in western Uganda with this brilliant man called Stanley Kasinde, who's a trauma surgeon and was working in Mbarara Regional Referral Hospital at the time. And together we piloted a trauma registry to collect data on the huge number of injuries that was predominantly affecting young members of the local population. And it was my first real insight into undertaking research, but more importantly, it helped me show how data could be a powerful tool for advocacy and policy change. And that interested me far more than the aspects of research methodology and the publication process. And then following foundation years, I did my professional diploma in tropical medicine and hygiene, like I think many people in this room will have. And I did it with LSHTM as part of their East African partnership, before reluctantly coming back to the UK to start my emergency medicine training in London. And I've had 18 months of out-of-programme time since, because I think my first bit of advice to those who are at the beginning or not in training yet, if you don't ask, you don't get. And I undertook the first part of that doing a postgraduate trauma fellowship in Kailicha Hospital, which is just a township just outside of Cape Town, and got back in February from a year in the Northern Territory of Australia, doing both hospital and retrieval work with predominantly remote Indigenous communities there. And there was some training in between. But whilst I was in ST1, I started a part-time MSc in Emergency Resuscitation Sciences at Queen Mary's University, London. And as part of this, I was expected to do a dissertation, which I really did not know where to start with. But fortuitously, around this time, I came across GECCo, and most importantly, Anissa. She helped me get involved with the Royal College's Global Health Mapping Project, which aims to improve collaboration amongst members undertaking global health work, which, as you can see from this snapshot of the map, generally does show work that really does cover the globe. And whilst it was clear when I was reading about this work, the value that this was providing to the healthcare systems that they're working in, what I wanted to understand was the effects that these experiences had on their return to working back in the NHS. And so we asked them. And so myself, Alex, who's sitting there, who amazingly we've actually never met in person, but have managed to publish a piece of research together. So amazing to be on a panel with you today. As well as Anissa, Claire and Charlotte, who aren't here today, carried out a qualitative study and undertook in-depth interviews of 20 multidisciplinary NHS staff who were working in emergency care, all with global health experience. And we define global health as using the kind of arch principle that Anissa laid out at the beginning. We undertook the interviews and analysed them using a methodology called reflexive thematic analysis. And there's not enough time to go into the basis of how this works, but if anyone is interested, this book by Braun and Clark at the bottom is the essential handbook for anyone who's going to undertake this methodological process, and it became my Bible during the research. And here, after combing through 100,000 words of transcribed interviews, is a graphical representation of our thematic analysis. and you can read it, but we found that emergency medicine is a specialty well positioned to undertake global health work for a whole host of reasons, and that doing global health work confers really tangible benefits to the practitioners involved in it, as well as to the system that they return to work in, namely for us, the NHS. And finally, there were consistently cited barriers to emergency care practitioners engaging in global health work, particularly during training programs. And if anyone wants to read the full paper, which goes into much more details about the findings and has quotes from those who were interviewed who put it into much better words than I ever will, I put a QR code at the end of the presentation so you can download it. And after submitting the dissertation, as I'm sure others have felt when submitting long pieces of work, I was happy to never think about the study again. But Anissa and my other co-authors helped me believe that the findings should be disseminated and help support me through the publication process, which, for those who've not gone through it yet, can be incredibly time-consuming and often dejecting. But after a year from the initial submission, the study was published in the EMJ last month and came out in print this week. In a... That's very kind, thank you. Yeah, reader's choice, thank you. And I was invited to share the study findings at the ArcM Staff Retention Study Day, which I wanted to try and advocate that undertaking global health work can lead to happier, more sustainable ED careers, something I really, really do believe in. And you can see little old me here in this picture on a panel with our college president, Adrian Boyle, a platform I could not have imagined when I started off on the piece of work. So I hope that's given, in 7 minutes, a whistle-stop tour of my journey into global health research. And I hope it can show that following your interests and using the amazing network of GECCo to seek out connections and collaborations can start some of your journeys into research today. Thanks so much. I really look forward to chatting to you both in the panel at the end of the day. Thanks.
Next, we've got Alex Taylor.
Hi everyone, it's lovely to see you all here today. I feel very similarly sort of an imposter syndrome from standing in front of you, because I was sat where you guys were sat 2 years ago, wondering how to get into research, how to do more research. I had a real sort of passion for stories and how we translate that into data that we can use, and I feel our general public utilises that, our press utilise that, and it's a form of research that I didn't have much exposure of. So this is a bit about my story, and hopefully it will spark some interest in some of you that also feel similarly in the audience. So in terms of my background, it's very much, I'm just going to put the lot of there, but just to say it's been very much a non-linear process. This is up there not to be intimidating, but I've dabbled in global health throughout my career and always looked for avenues sort of around busy training schedules or working abroad or having to complete exams and things to take opportunities to learn a bit more about research and to learn how to sort of build data that's going to be useful to our patients and our populations. I've been very lucky in that I've had educational opportunities to slowly build those skills, but I would encourage you, if you're somebody that feels like you want to get involved in research, because I think it can feel quite obtuse, or it can feel like quite technical at points, and it's hard to learn the skills that you need. You don't have to have a linear pathway, you don't have to be an academic, you just have to have an interest and a curiosity. And if you take some of the opportunities like I've done on this slide, then you will find that you'll explore some of these avenues, and you'll be able to build data that's useful to our patients. So probably for me, the pivotal thing that started my research journey was I did a diploma in exposition in wilderness medicine, and one of the attractions to that for me was that it allowed a dissertation that would feed into a global health master's. And at that point I had been doing expeditions out to Kilimanjaro, and I'd noticed that when you went as the medic, the intent from the groups was often that you would look after the Western participants that had gone, and there was no real attention to the porters and things that came with that group, and to me that felt like a hole that was missing, and I recognised from my medical colleagues that they felt similarly. And so what I did as part of my master's was I collected stories from medics that had gone and turned that into qualitative data. And for this I had to learn how to interview to extract the data that I needed. I had to learn how to code using the software to be able to extract themes from that and what people were saying, what was important, and I had to learn how to write up what I found afterwards. And it was quite a challenge. It's quite a challenge when you do your first piece like that as a dissertation. But it was what I came out with I felt was really important and really inspiring. Although acknowledging I'm yet to do something with that data. So to those in the room that may feel intimidated by research, at this point I've not made a poster ever. I've never published a single thing. I've always had an interest in utilising data, but I just haven't necessarily had the avenues of how. So if you're offered these kind of learning opportunities, please do take them, because it will build this knowledge slowly. And one of the key aspects I found is that having a community, and so this today is a community. You're all here in the room as a community, and speaking to people and exploring those interests and telling people why you're passionate about things and what you want to learn and asking about avenues that they've taken helps build this. And for me, when I was sat in GECCo 2 years ago, I was asking questions about qualitative research, and I met Anissa, and Anissa very kindly pulled me in to be involved in the really inspiring piece of research that Silas has just told you about. And from that, I was able to kind of build some more of my qualitative skills. So if I take you forward to our abstract, you don't need to read all of that. Obviously, Silas has sent you the paper, so it's very inspiring. I would recommend that you did at some point, but not right now. So I was able to bring some of the skills that I built from my previous dissertation and take them and translate them into this format. And I was a kind of extra coder in the research, and it was really inspiring to have something that was going to prove the value of global health work to emergency care, but also to the other kind of healthcare kind of communities that we're working with. And from there, I have been recruited to help with an additional qualitative study. So you'll see this later on because it's actually one of our short presentations, so I'm not going to, again, delve into this, but this has allowed me to take raw data again and to try and explore how our EM Leaders programme might translate into a Ghanaian setting and how it might meet the needs of that environment. So very similar to, I guess, what Lee is saying about our WHO sort of frameworks and guidelines that we're producing. Like, we have something we know works in a UK setting, and we're just trying to explore how that might fit a Ghanaian setting. And so utilising the raw data, trying to work out how to work across kind of different cultures, how to make sure that we work together as a team, although many of us work in emergency care and we work very kind of antisocial hours at times, has been really fascinating and just allowed me to build a bit more on those skills. Although I'm yet to go through the publication stage, so I've got that to look forward to. What I would say just before stepping back is that it's difficult sometimes to balance all of this, and I think you don't have to be in an academic training post, you don't have to be an academic to do this, but you do have to be cognizant about what's important to you and that you're taking enough time for yourself to rest, you're not burning out, you're meeting your other training requirements or meeting your other job requirements, and that can be really hard. But if you're sat in this room and you're passionate about stories and you're passionate about people and data and you think this is important, then a few hours here or there will allow you to build some of this knowledge that you can take forward to benefit our patients and our communities. I don't have Twitter because, as we mentioned earlier on, it's a bit of a bin fire, but I have an email if anyone wants to get in touch.
And finally, we've got Rosa, who will be sharing her experience.
Hi everyone. So as Anissa has pointed out, I had about 48 hours to present something. In that 48 hours, I also completed 2 13-hour shifts. So cobbled this together in my lunch break while trying to be in charge of a busy A&E department. So I apologise, it's not quite as polished as I would like it to be. Got a few prompts, so please bear with me. This is very much first steps into global research and emphasis on first steps. I consider myself very much a junior, sort of in the global health field, and I am flying the flag for the nurses in the room today because I feel like we are usually outweighed. So yes, I've been a GECCo member for several years now. I'm a senior sister at LTHT, which is based in Leeds, and I have an emergency care background. So a little bit about me to start off with. I graduated in 2019. Part of my BSc involved an international placement overseas in Zambia. It was a couple of weeks, really enjoyed it, and it really sparked an interest in global health, and so the rest is history, really. In 2019, I graduated right in the height of COVID, so it really was quite an introduction to nursing. Graduated, and 3 months later, COVID hit us in Leeds. So did that for about 2 years, and in that same period, I joined GECCo in around 2020. In 2022, we put on an event which is about the EM Nurse and Global Health. Some of you may have attended, some of you that might be slightly early for you guys, but it was a really, really interesting event, and I felt it was really important to put across what opportunities are available for nursing, as I have felt sort of while trying to get into the sector myself, that a lot of the opportunities, certainly that are formal or training routes, are generally geared to medics and those with medical degrees. So I feel quite strongly that we need to advocate for nurse involvement specifically. In about 2021, I got promoted to sister, and around that same time, I became the lead A&E nurse for CBRN and major incidents. So I'm also involved in the training requirements and capability for our department in Leeds to respond to mass casualty events, and also small-scale CBRN, for which we have actually had 1 major incident and 1 CBRN event since I took that role. And that sort of formed the basis for my interest in emergency preparedness, humanitarianism, conflict catastrophe, and essentially anything that involves disaster. It's my bag. Then I did a diploma in tropical nursing. I think it's very similar to what has been touched on already, that is also supported by SHTM, but very much a nursing focus, which again sort of solidified my interest in global health and propelled me forward. And then in 2023, I was really fortunate to be successful in my application for an MSc in Global Healthcare Leadership, which is a relatively new course which has been held at Keele University. Has really opened up a lot of doors to me, and I'll touch on that again in a second. And my current job, which I've been in for now a year or so, is at the sister hospital in Leeds, St James's, where I'm gaining more management experience as a senior sister there. So I just wanted to spend a little bit of time talking about my MSc in Global Healthcare Leadership, because it does involve a little bit of research, but like I say, incredibly junior in that regard. And the purposes of this course is really sort of the outcome being in search of a perfect healthcare system. As part of this course, which is made up of paramedics, pharmacists, doctors, nurses, people from NHS England data informatics, it's a really, really varied cohort which has allowed us to sort of really get a proper breadth of subject area and really delve into it. We have also had 3 international field trips that have been associated with the course. The first one was in Italy, so that was in June 2024. Purposes of this visit being health financing, health economics, and also regional healthcare systems, where you have a national health service, but actually the regions in Italy are responsible for spending their money how they wish to spend it. So in certain regions they spend more money on primary care, in certain regions they spend more money on secondary care, and this really vastly affected how different regions in Italy responded, and was affected by COVID specifically. So that was really, really interesting. In December 2024, I was lucky enough to go to Thailand on the Thai-Myanmar border, where we spent a bit of time learning about refugee and migrant health, but also the challenges of delivering healthcare in conflict-affected areas. And equally spent a little bit of time talking about the targeting of health workers and how difficult it is for them to train the workforce when they are actively targeted by the military when trying to deliver healthcare. We also went somewhere called the Sheffield Malaria Research Unit, so this is sort of the link to research, which I'm getting to, where we learned about the challenges of conducting primary care research and also disease surveillance along border regions that are affected by conflict. So that was incredibly interesting. Whilst I didn't have hands-on experience of this, it was really good to see that this is still ongoing in areas that are struggling. Next, I went to India. That was the most recent trip, so I came back a couple of months ago now, and we learnt about the healthcare workforce, the challenges of training, specifically for nurses, introducing the idea of nurses as a commodity, brain drain, all the rest of it. And it's really sparked an interest for me to sort of go into healthcare workforce and do some research in it as well, because it ties quite nicely with my role as workforce planning. As I've moved into a more senior management role within my own department, I'm also responsible for staffing gaps, employment and recruitment, and I do have quite strong opinions about ethical recruitment pathways. So with all of that, it has prompted a lot of interest in where do I go next, really. But it's also included a couple of research modules as well, which I'm going to get onto now. One such module was my research proposal, looking into sort of brain drain workforce, the challenges of employing nurses from LMICs, drawing them to HICs. But also this lends itself to completing a dissertation, which I am now in the throes of completing, and it is all quite scary. So to come on to that, my first introduction to the world of research was actually during my undergraduate degree, so when I did my BSc, and that was a compulsory dissertation, which was a literature review, which looked at quality of care for those who are limited English proficient in the NHS. And I found the whole experience, to be honest, really stressful and quite scary. And I think because it was compulsory for me to graduate, we were all very excited to just get started. And so it wasn't really the best introduction to dissertation, evidence synthesis and all the rest of it. And I remember distinctly saying to my parents, don't ever let me do one of these again. It's horrible, I don't like it. And then fast forward 6 years, and I'm currently completing an MSc, and I'm now doing another dissertation, and this time it's in the form of a scoping review. So scoping review, not primary research, form of evidence synthesis, and I'm looking at the breadth of experiences of international nurses that are working within our NHS, and hopefully this will lend itself to identifying gaps in the research to potentially look a little bit deeper at the ethical issues associated with employing nurses from poorer countries into our health system. So, lends itself to further study, sorry, bear with me. So I suppose the challenges that I'm finding while trying to complete this, like I say, it's due in sort of September time, so very much in its infancy, is that there is a great degree of unfamiliarity sort of with the research process, and it's very, very hard to balance it alongside a full-time job in A&E. But we're getting there, and I'm feeling positive, and I'm certainly enjoying this one a lot more than I did in my BSc, given that I've got full range and I'm allowed to pick something that really interests me. And because I'm so passionate about nursing and workforce, it's great that I can write about it and learn more about it and hopefully direct sort of future research into the area. What next, I suppose? Well, I'm very much a junior, very much in the infancy of my career, and still thinking about sort of where in the global health sphere do I actually fit. I'm hoping to take a career break next year. I'm hoping to get some more hands-on experience in global health. And there's quite a lot of opportunities sort of within my own trust. I've got some very, very supportive consultants that I work with, thank goodness, who are really flying the flag and sort of allowing me to progress sort of in their areas in global health as well. There's certainly a lot of international opportunities for nurses. They're just harder to find, and you know there is a lot out there. You just really do have to look. In terms of research, obviously I don't really know where I'm going, but my scoping review will lend itself to potentially doing some further study in the area, and it does sort of lend itself to maybe looking at something else in future. My mum keeps telling me, oh, you'll end up doing a PhD one day, and to be honest, she might be right. So the purpose of my presentation really being that, you know, if you are junior and not really knowing where to start, and certainly feel in some ways limited by your profession, because there are not as many opportunities, I would say, from my 6 years of searching, that there are a lot of opportunities. It just takes really a long time to look. These events are absolutely excellent for in terms of networking. There's always people involved in things. You just have to put yourself out there and ask the right questions. And yeah, if research is the passion, there are routes into it involving sort of MScs like the one I've done, which isn't primary research focused, but does lend itself to research modules, which then can lead to other opportunities. So there is a lot out there if you look for it. And certainly if you do have any questions for me, please approach me over the course of the day. My email's on the screen. Thank you.
Thank you so much to our panellists. Some great advice in there already, and lots of inspiring stories, lots within reach as well. Does anyone have any questions for our panellists?
Hi guys, so thanks for sharing your stories. So all of you had like your first forays into research, and then also while working a lot clinically as well. Kind of taking into account the breadth of experience, the shared knowledge you might have gained from others, Is there an item that you would say that you recommend as having the highest yield, best value, in terms of getting yourself familiar with research techniques and being able to take on research projects in the future, or designing your own, considering you've tried a few things of different types and then gone on to do projects yourself?
Let's take that.
Should we probably all want to say something briefly about that? Thank you for the question. I think from my perspective, it was undertaking a master's, which is a big thing in terms of when you're working clinically, but doing it over 3 years part-time I did think was still feasible, and also I'm doing full-time training in clinical work, which just forced me to have to do a big study, big piece of research, or 10,000 word dissertation, and it was that kind of that springboarded me into feeling kind of inspired enough to really focus on something that I wanted to do. So that was probably my most high yield thing.
Yeah, I'd probably say similarly. There's nothing quite like a compulsory dissertation module in the MSc which forces you to do it for completion. I think my master's part-time over 2 years, which has made it a lot more accessible and easier for me to maintain a career, but it does have its challenges. Unfortunately, I've not been very supported by my nursing management in order to do it. I don't get any time for it. I had to drop my hours and I had to take a pay cut, and I was actually actively dissuaded to do any further work. Obviously, that doesn't speak too highly of the management. I'll probably get told off for saying that, but there might be other trusts and other areas that are more supportive and have a little bit more of a global lens. It's just unfortunate that in my place of work, certainly in the nursing side, that wasn't very encouraged. That has been a real challenge. But I think sort of for me in the completion of my master's is knowing that there are a lot of people really spurring me on to do it and really excited that I'm doing it. And there are a lot of connections I've made through GECCo, but equally through my master's, a lot of people that you can ask. And their knowledge is absolutely crucial for me to have that support and continue. But it is very self-directed. You really have to have a passion for it. You really have to push yourself, because certainly for myself it's not been a very easy journey, but it will all be worth it in the end, or at least that's what I tell myself.
I think if you don't have bearing in mind there are financial barriers to doing a master's or a qualification, then actually what you need in that setting is a mentor of some description, because if you're not familiar with the pathway and the process, then you actually want somebody that, even if they aren't directly involved with your project, you can go to and just say, how do I go about ethics, or who do I send my ethics to, or how long is that process going to take me, and just kind of ask some of those questions, so that if you are doing this as an individual, which admittedly is probably harder if that's how you're going to start, but definitely still possible, then you have somebody that can at least guide you and make sure that you're not investing loads of hours around your busy job that aren't going to produce what you'd like it to.
Yeah, got another question?
My question is going to go to Rosa. Kind of share your passion for lack of opportunities for nurses, and in your current role as a senior assistant, and probably having worked with a lot of nurses from overseas who come in with a lot of experience. What is the support they are getting to share this experience within that small department, to also support their colleagues who might not have opportunities to travel outside, because some of these things come with 10 years, 15 years experience in doing stuff. And how do you intend to support them, translating these experiences or knowledge into evidence, which Lee did mention that we need a law to push global health?
Excellent. I knew you were going to target me. It's in my life. So I feel fortunate that through working my way up through management in my department, that I am in a better position to influence support for juniors that wish to do personal development, growth and health, research, whatever their passion is. I think we've got a massive retention problem with nurses, and generally the excuses for not allowing people to do extra things is because of staffing. What we're going to see is a long-term picture whereby if we are actively looking people to pursue their passions, we're actually going to drive them out faster. So I'm fortunate that by progressing in management, I think I am better placed now to support juniors that are interested. In terms of those that are internationally recruited, we have a wealth of information and a wealth of experience in our midst. I think it's sometimes overlooked. There are diaspora groups, there are forums, certainly within our THG, that are not perhaps very well advertised. But sort of in our department, what we've also created is an international nurse link role. That's quite new, something I've had some involvement in, whereby an internationally recruited nurse is the go-to person within our department for sort of any questions and support that they might need while they integrate into our system. Because we've got people coming in for their own economic reasons, they need to work in NHS, you know, it's well known across the globe. But we perhaps are not capitalising on what they can offer, what they can do, and how they can affect positive change. So I'm hoping that will help a lot in our department. There are obviously a lot of opportunities available, but it does generally come at a bit more personal cost, I suppose, for nursing. Because, like I say, we don't have mental health fellowships, we don't really have, there are some in existence near Bristol, but it's very much standalone to my knowledge. So we do need to do more to encourage people into pursuing their passions. It's not going to be an easy task. It's changing the perceptions and mindsets of a large number of people in management that it never even crossed their minds before. So it is difficult. But there are a lot of opportunities out there, and we need to just share knowledge really and see these people that come into our healthcare system to work, that they are supported and they're feeling valued, that their ideas and their breadth of experience we are also learning from. And I think I'm in a better position to do that now, but it's obviously not, it needs to be shared, that needs to be, everyone needs to be on board with that. And I think we'll get there one day, but we're just not quite there yet.
Great, I think we will wrap up questions there. Our three speakers are here all day, if anyone has any more questions for them. So join me in giving them another round of applause.